everyone. Today let's see what is McBurney's point. It is the maximum point of tenderness in acute appendicitis, which is a point that lies exactly around medial 2/3 and lateral 1/3 of a line that joins the anterior superior iliac spine, which is this structure, to the umbilicus. So it is at the point at the junction of medial 2/3 and lateral 1/3 of the line joining the anterior superior iliac spine to the umbilicus. So it exactly lies in the right iliac fossa region. Basically, we have abdomen divided into 9 quadrants by 4 lines, 2 vertical lateral lines and 2 horizontal lines. The horizontal lines are named as transpyloric plane, which is at the level of L1, and by transtubercular plane at the level of L5. Transpyloric in the sense it is crossing the pylorus of the stomach, and this is the transtubercular plane at L5, which is a line joining the tubercles of the iliac crests. So we have 9 quadrants by 2 vertical lines and 2 parallel lines. The vertical lines are those lines that are drawn laterally across the mid-inguinal point, 2 mid-inguinal points. This is the inguinal ligament, this is the pubic symphysis, this is the umbilicus, and these are the anterior superior iliac spines. This is the costal margin. Now, talking about acute appendicitis, there are some very basic things you have to know about this case. When you see it in the clinics, these points should be kept in your mind. Yeah, it is usually seen in children, adolescent group, and maximum between the age of 20 to 30 years, and it's rare before 2 years. The causes can be attributed to low fiber diet. This is an important cause. During these days, children usually have a lot of junk food and they are very much prone to acute appendicitis due to this reason. And also, you can give another explanation that in high class society or upper middle class society also have less of natural foods. Dietary vegetarian foods are included in a lesser proportion. So this is an important factor, low fiber diet. The next thing is familial susceptibility is of course there, familial susceptibility. Other important factor is obstruction. It can be due to a foreign body like worms, filarial worms or roundworms, etc. Or by any ficcolith, any foreign body located at the lumen of the appendix or stricture of the lumen of the appendix, or excess use of purgatives can also result. The excess use of laxatives can also be a cause for acute appendicitis. It's basically 2 types. One is the obstructive variety, and second one is the non-obstructive variety. The obstructive variety is fast progressing and the non-obstructive variety is slow progressing. Thing is, this is a bit emergency case, like it goes to gangrene and perforation very easily, obstructive type. Non-obstructive type is a slow one and it gives more time for treatment. The obstructive variety shows a colicky pain. It has a colicky pain, it's a powerful pain, while non-obstructive shows a dull aching pain. But the pain has a particular feature. The pain is initially elicited around the umbilical area. This is the region where the patient initially says about the pain, but later the pain will appear in the right iliac fossa. The reason is that appendix is basically a midgut organ during the intrauterine life. So irrespective of the position of appendix, initially it shows pain in the midline area, which is around the area of the umbilicus. Later on, when the symptoms are more intense, the pain is elicited in the right iliac fossa region because of the irritation of the parietal peritoneum on the appendix. Apart from pain, there can be fever, anorexia, vomiting, etc. So there is something called Murphy syndrome. This includes 3 symptoms mainly. They are pain, vomiting, and temperature.